Okay, we good to go? Good to go. We've got it. Do that right there. All right. Got feedback in my ears a little bit, but I think it's because the fan I have going. So I'll just bear with it. Does it really matter? 1,291. Does it really matter? Cumulative cumulative analysis of post-authorization adverse event reports of PF 073-02048 BNT 162B2 received through February 28, 2021. So as a disclaimer, I'm going to read their statement here for context. And as a disclaimer, the information contained in this document is proprietary and confidential. Any disclosure, reproduction, distribution, or other dissemination of this information outside of Pfizer, its affiliates, or its licensees, or regulatory agencies is strictly prohibited. Except as may be otherwise agreed to in writing. By accepting or reviewing these materials, you agree to hold such information in confidence and not to disclose it to others, except where required by applicable law, nor to use it for unauthorized purposes. Well, for the sake of this video, I am a regulatory agency. I have personal agency of regulating what happens in this world. Or at least this this world, my world. And as far as applicable law goes, exposure of uh, treason, exposure of crimes against humanity, that is uh, that is the applicable law. I just figured I'd share that. That was page 9. Table of contents. Just keep in mind, February 28th, 2021. So we're going to be going to this section right here. The review of adverse events of special interest. As in, there are adverse events that are not of special interest. This is the list of AESI's special interest ones. Of this list, there are 1,291 different types of adverse events. Okay. Scroll. Scroll 30, page 39. Here we go. So starting here, I'm going to switch and I'm going to hand the microphone over to
Appendix 1. List of adverse events of special interest. 1p36 deletion syndrome, 2 hydroxyglutaric aciduria, 5 nucleotidase increased, acoustic neuritis, acquired C1 inhibitor deficiency, acquired epidermolysis bullosa, acquired epileptic aphasia. Acute cutaneous lupus erythematosus, acute disseminated encephalomyelitis, acute encephalitis with refractory, repetitive partial seizures, acute febrile neutrophilic dermatoses, acute flaccid myelitis. Acute hemorrhagic leukoencephalitis, acute hemorrhagic edema of infancy, acute kidney injury, acute macular outer retinopathy, acute motor axonal neuropathy, acute motor sensory axonal neuropathy. Acute myocardial infarction, acute respiratory distress syndrome, acute respiratory failure, Addison's disease, administration site thrombosis, administration site vasculitis, adrenal thrombosis. Adverse event following immunization, ageusia, agranulocytosis, air embolism, alanine aminotransferase abnormal, alanine aminotransferase increased, alcoholic seizure, allergic bronchopulmonary mycosis. Allergic edema, alloimmune hepatitis, alopecia areata, Alpers disease, alveolar proteinosis, ammonia abnormal, ammonia increased, amniotic cavity infection, amygdalohippocampectomy, amyloid arthropathy. Amyloidosis, amyloidosis senile, anaphylactic reaction, anaphylactic shock, anaphylactic transfusion reaction, anaphylactoid reaction, anaphylactoid shock, anaphylactoid syndrome of pregnancy, angioedema. Angiopathic neuropathy, ankylosing spondylitis, anosmia, anti-acetylcholine receptor antibody positive, anti-actin antibody positive, anti-aquaporin 4 antibody positive, anti-basal ganglia antibody positive. Anticyclic citrullinated peptide antibody positive, anti-epithelial antibody positive, anti-erythrocyte antibody positive, anti-exosome complex antibody positive, anti-GAD antibody negative. Anti-GAD antibody positive, anti-ganglioside antibody positive, antigliadine antibody positive, anti-glomerular basement membrane antibody positive, anti-glomerular basement membrane disease. Anti-GLYCYL trinus synthetase antibody positive, anti-HLA antibody test positive, anti-IA2 antibody positive, anti-insulin antibody increased, anti-insulin antibody positive. Anti-insulin receptor antibody increased, anti-insulin receptor antibody positive, anti-interferon antibody negative, anti-interferon antibody positive, anti-islet cell antibody positive. Anti-mitochondrial antibody positive, anti-muscle specific kinase antibody positive, anti-myelin associated glycoprotein antibodies positive, anti-myelin associated glycoprotein associated polyneuropathy. Anti-myocardial antibody positive, anti-neuronal antibody positive, anti-neutrophil cytoplasmic antibody increased, anti-neutrophil cytoplasmic antibody positive. Anti-neutrophil cytoplasmic antibody positive vasculitis, anti-NMDA antibody positive, anti-nuclear antibody increased, anti-nuclear antibody positive, anti-phospholipid antibodies positive. Antiphospholipid syndrome, antiplatelet antibody positive, antiprothrombin antibody positive, antiribosomal P antibody positive, anti-RNA polymerase III antibody positive. Anti-Saccharomyces cerevisiae antibody test positive, anti-sperm antibody positive, anti-SRP antibody positive, anti-synthetase syndrome, anti-thyroid antibody positive. Anti-transglutaminase antibody increased, anti-VGCC antibody positive, anti-VGKC antibody positive, anti-vimentin antibody positive, antiviral prophylaxis, antiviral treatment. Anti-zinc transporter 8 antibody positive, aortic embolus, aortic thrombosis, aortitis, aplasia pure red cell, aplastic anemia, application site thrombosis, application site vasculitis, arrhythmia. Arterial bypass occlusion, arterial bypass thrombosis, arterial thrombosis, arteriovenous fistula thrombosis, arteriovenous graft site stenosis, arteriovenous graft thrombosis, arteritis, arteritis coronary. Arthralgia, arthritis, arthritis enteropathic, ascites, aseptic cavernous sinus thrombosis, aspartate aminotransferase abnormal, aspartate aminotransferase increased. Aspartate glutamate transporter deficiency, AST to platelet ratio index increased, AST/ALT ratio abnormal, asthma, asymptomatic COVID-19, ataxia, atherombolism, atonic seizures, atrial thrombosis. Atrophic thyroiditis, atypical benign partial epilepsy, atypical pneumonia, aura, autoantibody positive, autoimmune anemia, autoimmune aplastic anemia, autoimmune arthritis, autoimmune blistering disease. Autoimmune cholangitis, autoimmune colitis, autoimmune demyelinating disease, autoimmune dermatitis, autoimmune disorder, autoimmune encephalopathy, autoimmune endocrine disorder, autoimmune enteropathy. Autoimmune eye disorder, autoimmune hemolytic anemia, autoimmune heparin-induced thrombocytopenia, autoimmune hepatitis, autoimmune hyperlipidemia, autoimmune hypothyroidism. Autoimmune inner ear disease, autoimmune lung disease, autoimmune lymphoproliferative syndrome, autoimmune myocarditis, autoimmune myositis, autoimmune nephritis, autoimmune neuropathy. Autoimmune neutropenia, autoimmune pancreatitis, autoimmune pancytopenia, autoimmune pericarditis, autoimmune retinopathy, autoimmune thyroid disorder, autoimmune thyroiditis, autoimmune uveitis. Autoinflammation with infantile enterocolitis, autoinflammatory disease, automatism epileptic, autonomic nervous system imbalance, autonomic seizure, axial spondyloarthritis, axillary vein thrombosis. Axonal and demyelinating polyneuropathy, axonal neuropathy, bacterocytes, Baltic myoclonic epilepsy, band sensation, Bastos disease, basilar artery thrombosis, basophilopenia, B-cell aplasia. Behçet's syndrome, benign ethnic neutropenia, benign familial neonatal convulsions, benign familial pemphigus, benign Rolandic epilepsy, beta-2 glycoprotein antibody positive, Bickerstaff's encephalitis. Bile output abnormal, bile output decreased, biliary ascites, bilirubin conjugated abnormal, bilirubin conjugated increased, bilirubin urine present, biopsy liver abnormal, biotinidase deficiency. Birdshot chorioretinopathy, blood alkaline phosphatase abnormal, blood alkaline phosphatase increased, blood bilirubin abnormal, blood bilirubin increased, blood bilirubin unconjugated increased. Blood cholinesterase abnormal, blood cholinesterase decreased, blood pressure decreased, blood pressure diastolic decreased, blood pressure systolic decreased, Bluetooth syndrome. Brachiocephalic vein thrombosis, brainstem embolism, brainstem thrombosis, bromosulfathaline test abnormal, bronchial edema, bronchitis, bronchitis mycoplasmal, bronchitis viral. Bronchopulmonary aspergillosis allergic, bronchospasm, Budd-Chiari syndrome, bulbar palsy, butterfly rash, C1q nephropathy, caesarean section, calcium embolism, capillarities, Kaplan syndrome. Cardiac amyloidosis, cardiac arrest, cardiac failure acute, cardiac sarcoidosis, cardiac ventricular thrombosis, cardiogenic shock, cardiolipin antibody positive, cardiopulmonary failure. Cardiorespiratory arrest, cardiorespiratory distress, cardiovascular insufficiency, carotid arterial embolus, carotid artery thrombosis, cataplexy, catheter site thrombosis, catheter site vasculitis. Cavernous sinus thrombosis, CDKL5 deficiency disorder, CEC syndrome, cement embolism, central nervous system lupus, central nervous system vasculitis, cerebellar artery thrombosis, cerebellar embolism. Cerebral amyloid angiopathy, cerebral arteritis, cerebral artery embolism, cerebral artery thrombosis, cerebral gas embolism, cerebral microembolism, cerebral septic infarct, cerebral thrombosis, cerebral venous sinus thrombosis, cerebral venous thrombosis, cerebrospinal thrombotic tamponade, cerebrovascular accident, change in seizure presentation, chest discomfort. Child Pugh-Turcotte score abnormal, child Pugh-Turcotte score increased, chilblains, choking, choking sensation, cholangitis sclerosing, chronic autoimmune glomerulonephritis. Chronic cutaneous lupus erythematosus, chronic fatigue syndrome, chronic gastritis, chronic inflammatory demyelinating polyradiculoneuropathy. Chronic lymphocytic inflammation with pontine perivascular enhancement responsive to steroids, chronic recurrent multifocal osteomyelitis, chronic respiratory failure, chronic spontaneous urticaria. Circulatory collapse, circumoral edema, circumoral swelling, clinically isolated syndrome, clonic convulsion, coeliac disease, Cogan syndrome, cold agglutinins positive, cold type hemolytic anemia. Colitis, colitis erosive, colitis herpes, colitis microscopic, colitis ulcerative, collagen disorder, collagen vascular disease, complement factor abnormal, complement factor C1 decreased. Complement factor C2 decreased, complement factor C3 decreased, complement factor C4 decreased, complement factor decreased, computerized tomogram liver abnormal, concentric sclerosis, congenital anomaly. Congenital bilateral perisylvian syndrome, congenital herpes simplex infection, congenital myasthenic syndrome, congenital varicella infection, congestive hepatopathy, convulsion in childhood. Convulsions local, convulsive threshold lowered, Coombs positive hemolytic anemia, coronary artery disease, coronary artery embolism, coronary artery thrombosis, coronary bypass thrombosis. Coronavirus infection, coronavirus test negative, coronavirus test positive, corpus callosotomy, cough, cough variant asthma, COVID-19, COVID-19 immunization, COVID-19 pneumonia. COVID-19 prophylaxis, COVID-19 treatment, cranial nerve disorder, cranial nerve palsies multiple, cranial nerve paralysis, CRESS syndrome, Crohn's disease, cryofibrinogenemia, cryoglobulinemia. CSF oligoclonal band present, CSWS syndrome, cutaneous amyloidosis, cutaneous lupus erythematosus, cutaneous sarcoidosis, cutaneous vasculitis, cyanosis, cyclic neutropenia, cystitis interstitial. Cytokine release syndrome, cytokine storm, de novo purine synthesis inhibitors associated acute inflammatory syndrome, death neonatal, deep vein thrombosis postoperative. Deficiency of bile secretion, déjà vu, demyelinating polyneuropathy, demyelination, dermatitis, dermatitis bullous, dermatitis herpetiformis, dermatomyositis, device embolization, device-related thrombosis. Diabetes mellitus, diabetic ketoacidosis, diabetic mastopathy, dialysis amyloidosis, dialysis membrane reaction, diastolic hypotension, diffuse vasculitis, digital pitting scar. Disseminated intravascular coagulation, disseminated intravascular coagulation in newborn, disseminated neonatal herpes simplex, disseminated varicella. Disseminated varicella zoster vaccine virus infection, disseminated varicella zoster virus infection, DNA antibody positive, double cortex syndrome, double-stranded DNA antibody positive, dreamy state. Dressler's syndrome, drop attacks, drug withdrawal convulsions, dyspnoea, early infantile epileptic encephalopathy with burst suppression, eclampsia, eczema herpeticum, embolia cutis medicamentosa. Embolic cerebellar infarction, embolic cerebral infarction, embolic pneumonia, embolic stroke, embolism, embolism arterial, embolism venous, encephalitis, encephalitis allergic, encephalitis autoimmune, encephalitis brainstem, encephalitis hemorrhagic, encephalitis paradoxialis diffusa, encephalitis post-immunization, encephalomyelitis, encephalopathy, endocrine disorder, endocrine ophthalmopathy, endotracheal intubation, enterithes, enterithes leukopenic, enterobacter pneumonia, enterocolitis, enteropathic spondylitis, eosinopenia, eosinophilic fasciitis, eosinophilic granulomatosis with polyangiitis, eosinophilic esophagitis, epidermolysis, epilepsy, epilepsy surgery, epilepsy with myoclonic-atonic seizures, epileptic aura, epileptic psychosis, erythema, erythema induratum, erythema multiforme, erythema nodosum, Evans syndrome, exanthema subidum, expanded disability status scale score decreased, expanded disability status scale score increased, exposure to communicable disease, exposure to SARS-CoV-2, eye edema, eye pruritus, eye swelling, eyelid edema, face edema, facial paralysis, facial paresis, fatiobrachial dystonic seizure, fat embolism, febrile convulsion, febrile infection-related epilepsy syndrome, febrile neutropenia, Felty syndrome, femoral artery embolism, fibrillary glomerulonephritis, fibromyalgia, flushing, foaming at mouth, focal cortical resection, focal dyscognitive seizures, fetal distress syndrome, fetal placental thrombosis, fetor hepaticus, foreign body embolism, frontal lobe epilepsy, fulminant type 1 diabetes mellitus, galactose elimination capacity test abnormal, galactose elimination capacity test decreased, gamma-glutamyl transferase abnormal, gamma-glutamyl transferase increased, gastritis herpes, gastrointestinal amyloidosis, gelastic seizure, general east onset non-motor seizure, general east tonic-clonic seizure, genital herpes simplex, genital herpes zoster, giant cell arteritis, glomerulonephritis, glomerulonephritis membranoproliferative, glomerulonephritis membranous, glomerulonephritis rapidly progressive, glossopharyngeal nerve paralysis, glucose transporter type 1 deficiency syndrome, glutamate dehydrogenase increased, glycocholic acid increased, GM2 gangliosidosis, Goodpasture's syndrome, graft thrombosis, granulocytopenia, granulocytopenia neonatal, granulomatosis with polyangiitis, granulomatous dermatitis, gray matter heterotopia, guanase increased, Guillain-Barré syndrome, hemolytic anemia, hemophagocytic lymphohistiocytosis, hemorrhage, hemorrhagic ascites, hemorrhagic disorder, hemorrhagic pneumonia, hemorrhagic varicella syndrome, hemorrhagic vasculitis, hantavirus pulmonary infection, Hashimoto's encephalopathy, Hashidic hemimegalencephaly, Hanox-Conline purpura, Hanox-Conline purpura nephritis, hepaplastin abnormal, hepaplastin decreased, heparin-induced thrombocytopenia, hepatic amyloidosis, hepatic artery embolism, hepatic artery flow decreased, hepatic artery thrombosis, hepatic enzyme abnormal, hepatic enzyme decreased, hepatic enzyme increased, hepatic fibrosis marker abnormal, hepatic fibrosis marker increased, hepatic function abnormal, hepatic hydrothorax, hepatic hypertrophy, hepatic hypoperfusion, hepatic lymphocytic infiltration, hepatic mass, hepatic pain, hepatic sequestration, hepatic vascular resistance increased, hepatic vascular thrombosis, hepatic vein embolism, hepatic vein thrombosis, hepatic venous pressure gradient abnormal, hepatic venous pressure gradient increased, hepatitis, hepatobiliary scan abnormal, hepatomegaly, hepatosplenomegaly, hereditary angioedema with C1 esterase inhibitor deficiency, herpes dermatitis, herpes gestationis, herpes esophagitis, herpes ophthalmic, herpes pharyngitis, herpes sepsis, herpes simplex. Herpes simplex cervicides, herpes simplex colitis, herpes simplex encephalitis, herpes simplex gastritis, herpes simplex hepatitis, herpes simplex meningitis, herpes simplex meningoencephalitis, herpes simplex meningomyelitis, herpes simplex necrotizing retinopathy, herpes simplex esophagitis, herpes simplex otitis externa, herpes simplex pharyngitis, herpes simplex pneumonia, herpes simplex reactivation, herpes simplex sepsis, herpes simplex viremia, herpes simplex virus conjunctivitis neonatal, herpes simplex visceral, herpes virus infection, herpes zoster. Herpes zoster cutaneous disseminated, herpes zoster infection neurological, herpes zoster meningitis, herpes zoster meningoencephalitis, herpes zoster meningomyelitis, herpes zoster meningoradiculitis, herpes zoster necrotizing retinopathy, herpes zoster oticus, herpes zoster pharyngitis, herpes zoster reactivation, herpetic radiculopathy, histone antibody positive, Hoyne syndrome. Human herpes virus 6 encephalitis, human herpes virus 6 infection, human herpes virus 6 infection reactivation, human herpes virus 7 infection, human herpes virus 8 infection, hyperammonemia, hyperbilirubinemia, hypercholia, hypergammaglobulinemia benign monoclonal, hyperglycemic seizure, hypersensitivity, hypersensitivity vasculitis, hyperthyroidism, hypertransaminasemia, hyperventilation, hypoalbuminemia, hypocalcemic seizure, hypogammaglobulinemia, hypoglossal nerve paralysis, hypoglossal nerve paresis, hypoglycemic seizure, hypoatriemic seizure, hypotension, hypotensive crisis, Hypothenar-Hammer syndrome, hypothyroidism, hypoxia, idiopathic CD4 lymphocytopenia, idiopathic generalized epilepsy, idiopathic interstitial pneumonia, idiopathic neutropenia, idiopathic pulmonary fibrosis, IgA nephropathy, IgM nephropathy, IIIRD nerve paralysis, IIIRD nerve paresis, iliac artery embolism, immune thrombocytopenia, immune-mediated adverse reaction, immune-mediated cholangitis, immune-mediated cholestasis, immune-mediated cytopenia, immune-mediated encephalitis, immune-mediated encephalopathy, immune-mediated endocrinopathy, immune-mediated enterocolitis, immune-mediated gastritis, immune-mediated hepatic disorder, immune-mediated hepatitis, immune-mediated hyperthyroidism, immune-mediated hypothyroidism, immune-mediated myocarditis, immune-mediated myositis, immune-mediated nephritis, immune-mediated neuropathy, immune-mediated pancreatitis, immune-mediated pneumonitis, immune-mediated renal disorder, immune-mediated thyroiditis, immune-mediated uveitis, immunoglobulin G4 related disease, immunoglobulins abnormal, implant site thrombosis, inclusion body myositis, infantile genetic agranulocytosis, infantile spasms, infected vasculitis, infective thrombosis, inflammation, inflammatory bowel disease, infusion site thrombosis, infusion site vasculitis, injection site thrombosis, injection site urticaria, injection site vasculitis, installation site thrombosis, insulin autoimmune syndrome, interstitial granulomatous dermatitis, interstitial lung disease, intracardiac mass, intracardiac thrombus, intracranial pressure increased, intrapericardial thrombosis, intrinsic factor antibody abnormal, intrinsic factor antibody positive, IPEX syndrome, irregular breathing, Irvin syndrome, IVTH nerve paralysis, IVTH nerve paresis, JC polyomavirus test positive, JC virus CSF test positive, Javan syndrome, jugular vein embolism, jugular vein thrombosis, juvenile idiopathic arthritis, juvenile myoclonic epilepsy, juvenile polymyositis, juvenile psoriatic arthritis, juvenile spondyloarthritis, Kaposi sarcoma, inflammatory cytokine syndrome, Kawasaki's disease, Kaiser-Fleischer ring, keratoderma blenorrhagica, ketosis-prone diabetes mellitus, Kaunas syndrome. Lafora's myoclonic epilepsy, Lamblos excrescences, laryngeal dyspnoea, laryngeal edema, laryngeal rheumatoid arthritis, laryngospasm, laryngotracheal edema, latent autoimmune diabetes in adults. LE cells present, Lemierre syndrome, Lennox-Gastaut syndrome, leucine aminopeptidase increased, leukoencephalomyelitis, leukoencephalopathy, leukopenia, leukopenia neonatal, Lewis-Sumner syndrome. Lermid's sign, lichen planopilaris, lichen planus, lichen sclerosus, limbic encephalitis, linear IgA disease, lipedema, lip swelling, liver function test abnormal, liver function test decreased. Liver function test increased, liver induration, liver injury, liver iron concentration abnormal, liver iron concentration increased, liver opacity, liver palpable, liver sarcoidosis, liver scan abnormal. Liver tenderness, low birth weight baby, lower respiratory tract herpes infection, lower respiratory tract infection, lower respiratory tract infection viral, lung abscess, lipoid hepatic cirrhosis. Lupus cystitis, lupus encephalitis, lupus endocarditis, lupus erythrithes, lupus hepatitis, lupus myocarditis, lupus myositis, lupus nephritis, lupus pancreatitis, lupus pleurisy, lupus pneumonitis. Lupus vasculitis, lupus-like syndrome, lymphocytic hypophysitis, lymphocytopenia neonatal, lymphopenia, MAGIC syndrome, magnetic resonance imaging liver abnormal. Magnetic resonance proton density fat fraction measurement, Mahler sign, manufacturing laboratory analytical testing issue, manufacturing materials issue, manufacturing production issue. Marburg's variant multiple sclerosis, Marchiafava-Bignami disease, Marine Lenhart syndrome, mastocytic enterocolitis, maternal exposure during pregnancy, medical device site thrombosis. Medical device site vasculitis, MELA syndrome, meningitis, meningitis aseptic, meningitis herpes, meningoencephalitis herpes simplex neonatal, meningoencephalitis herpetic, meningomyelitis herpes. MERS-CoV test, MERS-CoV test negative, MERS-CoV test positive, mesangioproliferative glomerulonephritis, mesenteric artery embolism, mesenteric artery thrombosis, mesenteric vein thrombosis. Metapneumovirus infection, metastatic cutaneous Crohn's disease, metastatic pulmonary embolism, microangiopathy, microembolism, microscopic polyangiitis, Middle East respiratory syndrome. Migraine-triggered seizure, miliary pneumonia, Miller-Fisher syndrome, mitochondrial aspartate aminotransferase increased, mixed connective tissue disease, model for end-stage liver disease score abnormal. Model for end-stage liver disease score increased, molar ratio of total branched-chain amino acid to tyrosine, molybdenum cofactor deficiency, monocytopenia, mononeuritis, mononeuropathy multiplex. Morpho-E, Morvan syndrome, mouth swelling, moyamoya disease, multifocal motor neuropathy, multiple organ dysfunction syndrome, multiple sclerosis relapse. Multiple sclerosis relapse prophylaxis, multiple subpial transection, multisystem inflammatory syndrome in children, muscular sarcoidosis, myasthenia gravis crisis. Myasthenia gravis neonatal, myasthenic syndrome, myelitis transverse, myocardial infarction, myocarditis post-infection, myoclonic epilepsy and ragged red fibers. Myochemia, myositis, narcolepsy, nasal herpes, nasal obstruction, necrotizing herpetic retinopathy, neonatal Crohn's disease, neonatal epileptic seizure, neonatal lupus erythematosus. neonatal mucocutaneous herpes simplex, neonatal pneumonia, neonatal seizure, nephritis, nephrogenic systemic fibrosis, neuralgic amyotrophy, neuritis, neuritis cranial, neuromyelitis optica pseudo-relapse, neuromyelitis optica spectrum disorder, neuromyotonia, neuronal neuropathy, neuropathy peripheral, neuropathy, ataxia, retinitis pigmentosa syndrome, neuropsychiatric lupus, neurosarcoidosis, neutropenia. Neutropenia neonatal, neutropenic colitis, neutropenic infection, neutropenic sepsis, nodular rash, nodular vasculitis, non-infectious myelitis, non-infective encephalitis, non-infective encephalomyelitis. Non-infective oophoritis, obstetrical pulmonary embolism, occupational exposure to communicable disease, occupational exposure to SARS-CoV-2, ocular hyperemia, ocular myasthenia, ocular pemphigoid. Ocular sarcoidosis, ocular vasculitis, oculofacial paralysis, edema, edema blister, edema due to hepatic disease, edema mouth, esophageal achalasia, ophthalmic artery thrombosis. Ophthalmic herpes simplex, ophthalmic herpes zoster, ophthalmic vein thrombosis, optic neuritis, optic neuropathy, optic paraneuritis, oral herpes, oral lichen planus, oropharyngeal edema. Oropharyngeal spasm, oropharyngeal swelling, osmotic demyelination syndrome, ovarian vein thrombosis, overlap syndrome. Pediatric autoimmune neuropsychiatric disorders associated with streptococcal infection, Paget-Schroeder syndrome, palindromic rheumatism, palisade neutrophilic granulomatous dermatitis. Palmoplantar keratoderma, palpable purpura, pancreatitis, panencephalitis, papillophlebitis, paracancerous pneumonia, paradoxical embolism, parainfluenza viral laryngotracheobronchitis. Paraneoplastic dermatomyositis, paraneoplastic pemphigus, paraneoplastic thrombosis, paresis cranial nerve, parietal cell antibody positive, paroxysmal nocturnal hemoglobinuria, partial seizures. Partial seizures with secondary generalization, patient isolation, pelvic venous thrombosis, pemphigoid, pemphigus, penile vein thrombosis, pericarditis, pericarditis lupus, perihepatic discomfort. Periorbital edema, periorbital swelling, peripheral artery thrombosis, peripheral embolism, peripheral ischemia, peripheral vein thrombus extension, periportal edema, peritoneal fluid protein abnormal. Peritoneal fluid protein decreased, peritoneal fluid protein increased, peritonitis lupus, pernicious anemia, petit mal epilepsy, pharyngeal edema, pharyngeal swelling. Pityriasis lichenoides et varioliformis acuta, placenta previa, pluriparenchymal fibroelastosis, pneumobilia, pneumonia, pneumonia adenoviral, pneumonia cytomegaloviral, pneumonia herpes viral. Pneumonia influenzal, pneumonia measles, pneumonia mycoplasmal, pneumonia necrotizing, pneumonia parainfluenza viral, pneumonia respiratory syncytial viral, pneumonia viral, POEM syndrome. Polyarteritis nodosa, polyarthritis, polychondritis, polyglandular autoimmune syndrome type I, polyglandular autoimmune syndrome type 2, polyglandular autoimmune syndrome type 3, polyglandular disorder. Polymicrogyria, polymyalgia rheumatica, polymyositis, polyneuropathy, polyneuropathy idiopathic progressive, portal paemia, portal vein embolism, portal vein flow decreased, portal vein pressure increased. Portal vein thrombosis, portosplenomysenteric venous thrombosis, post-procedural hypotension, post-procedural pneumonia, post-procedural pulmonary embolism, post-stroke epilepsy, post-stroke seizure. Post-thrombotic retinopathy, post-thrombotic syndrome, post-viral fatigue syndrome, postictal headache, postictal paralysis, postictal psychosis, postictal state, postoperative respiratory distress, postoperative respiratory failure, postoperative thrombosis, postpartum thrombosis, postpartum venous thrombosis, post-pericardiotomy syndrome, post-traumatic epilepsy, postural orthostatic tachycardia syndrome, precerebral artery thrombosis, preeclampsia, preictal state, premature labor, premature menopause, primary amyloidosis, primary biliary cholangitis, primary progressive multiple sclerosis, procedural shock, proctitis herpes, proctitis ulcerative, product availability issue, product distribution issue, product supply issue, progressive facial hemiatrophy, progressive multifocal leukoencephalopathy, progressive multiple sclerosis, progressive relapsing multiple sclerosis, prosthetic cardiac valve thrombosis, pruritus, pruritus allergic, pseudovasculitis, psoriasis, psoriatic arthropathy, pulmonary amyloidosis, pulmonary artery thrombosis, pulmonary embolism, pulmonary fibrosis, pulmonary hemorrhage, pulmonary microembolus, pulmonary oil microembolism, pulmonary renal syndrome, pulmonary sarcoidosis, pulmonary sepsis, pulmonary thrombosis, pulmonary tumor thrombotic microangiopathy, pulmonary vasculitis, pulmonary veno-occlusive disease, pulmonary venous thrombosis, pyoderma gangrenosum, pyostomatitis vegitans, pyrexia, quarantine, radiation leukopenia, radiculitis brachial, radiologically isolated syndrome, rash, rash erythematous, rash pruritic, Rasmussen encephalitis, Raynaud's phenomenon, reactive capillary endothelial proliferation, relapsing multiple sclerosis, relapsing remitting multiple sclerosis, renal amyloidosis, renal arteritis, renal artery thrombosis, renal embolism, renal failure, renal vascular thrombosis, renal vasculitis, renal vein embolism, renal vein thrombosis, respiratory arrest, respiratory disorder, respiratory distress, respiratory failure, respiratory paralysis, respiratory syncytial virus bronchiolitis, respiratory syncytial virus bronchitis, retinal artery embolism, retinal artery occlusion, retinal artery thrombosis, retinal vascular thrombosis, retinal vasculitis, retinal vein occlusion, retinal vein thrombosis, retinol binding protein decreased, retinopathy, retrograde portal vein flow, retroperitoneal fibrosis, reversible airways obstruction, Reynolds syndrome, rheumatic brain disease, rheumatic disorder, rheumatoid arthritis, rheumatoid factor increased, rheumatoid factor positive, rheumatoid factor quantitative increased, rheumatoid lung, rheumatoid neutrophilic dermatoses, rheumatoid nodule removal, rheumatoid scleritis, rheumatoid vasculitis, SACCADICI movement, SAPHO syndrome, sarcoidosis, SARS-CoV-1 test, SARS-CoV-1 test negative, SARS-CoV-1 test positive, SARS-CoV-2 antibody test, SARS-CoV-2 antibody test negative, SARS-CoV-2 antibody test positive, SARS-CoV-2 carrier, SARS-CoV-2 sepsis, SARS-CoV-2 test, SARS-CoV-2 test false negative, SARS-CoV-2 test false positive, SARS-CoV-2 test negative, SARS-CoV-2 test positive, SARS-CoV-2 viremia, Sato-Yoshi syndrome, schizencephaly, scleritis, sclerodactylia, scleroderma, scleroderma-associated digital ulcer, scleroderma renal crisis, scleroderma-like reaction, secondary amyloidosis, secondary cerebellar degeneration, secondary progressive multiple sclerosis, segmented hyalinizing vasculitis, seizure, seizure anoxic, seizure cluster, seizure-like phenomena, seizure prophylaxis, sensation of foreign body, septic embolus, septic pulmonary embolism, severe acute respiratory syndrome, severe myoclonic epilepsy of infancy, shock symptom. Shrinking lung syndrome, shunt thrombosis, silent thyroiditis, simple partial seizures, Sjogren's syndrome, skin swelling, SLE arthritis, smooth muscle antibody positive, sneezing, spinal artery embolism. Spinal artery thrombosis, splenic artery thrombosis, splenic embolism, splenic thrombosis, splenic vein thrombosis, spondylitis, spondyloarthropathy, spontaneous heparin-induced thrombocytopenia syndrome. Status epilepticus, Stevens-Johnson syndrome, stiff leg syndrome, stiff person syndrome, stillbirth, Still's disease, stomach-site thrombosis, stomach-site vasculitis, stress cardiomyopathy, stridor. Subacute cutaneous lupus erythematosus, subacute endocarditis, subacute inflammatory demyelinating polyneuropathy, subclavian artery embolism, subclavian artery thrombosis, subclavian vein thrombosis. Sudden unexplained death in epilepsy, superior sagittal sinus thrombosis, Sussex syndrome, suspected COVID-19, swelling face, swelling of eyelid, swollen tongue, sympathetic ophthalmia. Systemic lupus erythematosus, systemic lupus erythematosus disease activity index abnormal, systemic lupus erythematosus disease activity index decreased. Systemic lupus erythematosus disease activity index increased, systemic lupus erythematosus rash, systemic scleroderma, systemic sclerosis pulmonary, tachycardia, tachypnea, Takayasu's arteritis. Temporal lobe epilepsy, terminal ileitis, testicular autoimmunity, throat tightness, thromboangiitis obliterans, thrombocytopenia, thrombocytopenic purpura, thrombophlebitis, thrombophlebitis migrans. Thrombophlebitis neonatal, thrombophlebitis septic, thrombophlebitis superficial, thromboplastin antibody positive, thrombosis, thrombosis corpora cavernosa, thrombosis in device. Thrombosis mesenteric vessel, thrombotic cerebral infarction, thrombotic microangiopathy, thrombotic stroke, thrombotic thrombocytopenic purpura, thyroid disorder. Thyroid stimulating immunoglobulin increased, thyroiditis, tongue amyloidosis, tongue biting, tongue edema, tonic clonic movements, tonic convulsion, tonic posturing, topectomy, total bile acids increased. Toxic epidermal necrolysis, toxic leukoencephalopathy, toxic oil syndrome, tracheal obstruction, tracheal edema, tracheobronchitis, tracheobronchitis mycoplasmal, tracheobronchitis viral. Transaminases abnormal, transaminases increased, transfusion-related alloimmune neutropenia, transient epileptic amnesia, transverse sinus thrombosis, trigeminal nerve paresis, trigeminal neuralgia. Trigeminal palsy, truncoceliacus thrombosis, tuberous sclerosis complex, tubulointerstitial nephritis and uveitis syndrome, tumefactive multiple sclerosis, tumor embolism, tumor thrombosis. Type 1 diabetes mellitus, type I hypersensitivity, type 3 immune complex mediated reaction, Uthoff's phenomenon, ulcerative keratitis, ultrasound liver abnormal, umbilical cord thrombosis, uncinate fits. Undifferentiated connective tissue disease, upper airway obstruction, urine bilirubin increased, urobilinogen urine decreased, urobilinogen urine increased, urticaria, urticaria papular. Urticarial vasculitis, uterine rupture, uveitis, vaccination site thrombosis, vaccination site vasculitis, vagus nerve paralysis, varicella, varicella keratitis, varicella post-vaccine. Varicella zoster gastritis, varicella zoster esophagitis, varicella zoster pneumonia, varicella zoster sepsis, varicella zoster virus infection, vasa previa, vascular graft thrombosis. Vascular pseudoaneurysm thrombosis, vascular purpura, vascular stent thrombosis, vasculitic rash, vasculitic ulcer, vasculitis, vasculitis gastrointestinal, vasculitis necrotizing, vena cava embolism, vena cava thrombosis, venous intravasation, venous recanalization, venous thrombosis in pregnancy, venous thrombosis limb, venous thrombosis neonatal, vertebral artery thrombosis, vessel puncture site thrombosis, visceral venous thrombosis, vagus nerve paralysis, vagus nerve paresis, vitiligo, vocal cord paralysis, vocal cord paresis, Voigt-Koyanagi-Harada disease, worm-type hemolytic anemia, wheezing, white nipple sign, X-ith nerve paralysis, X-ray hepatobiliary abnormal, Young syndrome, Zika virus-associated Guillain-Barré syndrome.
That was pretty brutal. I mean, I'm almost surprised that polydactylism wasn't on the list. You know, that list. 1,291. I mean,
What is polydactyls?
polydactylism is allegedly a genetic disorder when you have more or less fingers than you're supposed to, typically more. I'm gonna turn my fan off because it actually does bother me.
What was the list referencing? I missed that.
So, this list is from Pfizer BioNTech, February 28, 2021. So approximately 2 months worth of data resulted in 1,291 adverse events of special interest.
Wow.
And again, 2 months of data, 1,291, of which literally
was that off of VIIRS, or was that like is this Pfizer's data?
This is the report, the private confidential report of Pfizer, of which I read the not for use for unauthorized purposes disclaimer. I'll share my screen so you can see what I'm talking about. This is the document. I posted the link in the chat for anybody's use. I'll post it again there in the chat. That's where this came from, and I was tempted to read all of this myself, but that took the robot 40 minutes.
It's substantial.
Yeah, it's 9 pages long, and this is a confidential Pfizer document that was shared. Somebody in the government of Nevada, state government, leaked a PDF involving email conversation. So emails back and forth between these different people that were basically um, begging the Nevada state government to not mandate, um, right? So there's all these
Yeah.
emails at the beginning of this document, and then they include the cumulative analysis of post-authorization adverse event reports from Pfizer BioNTech, um, and that portion of the PDF is 60 pages long. And this, of course, is only the small
9
part,
of them.
the tiny part, because they had hundreds of thousands of pages, I believe, um, that they would be um, reporting on.
Yeah.
I mean, and you got charts in this on the adverse event reports. You've got your non-serious versus your serious. It's about 50-50. It's about 50-50.
It seems like a lot.
I mean, it's only 3% of the people that got tachycardia, for instance. But yeah, I mean, they break it all down. They break it
Well, what
all
if you
down.
already have tachycardia?
What's that?
I said, what if you already had tachycardia?
Well, that's the thing. It's an adverse event as opposed. It's not supposed to be something that's pre-existing. In order for it to be an adverse event, it's supposed to be something that's new.
Right.
Supposed to be, as far as I understand it. So, um, let's
Well,
see.
because that's been my argument for a while now. It's like, hey, like COVID gave me myocarditis, so like, why would I want to get this COVID vaccine that's also known to give me myocarditis? Like, it seems bad to me. Like,
Yeah.
because like my blood pressure has been out of whack since I got COVID. So,
What kind of numbers, if you don't mind sharing?
like 150/70 to 170/70.
So the top number has been pretty high. Yeah.
Yeah, yeah. My wife's like, you're probably 20 points away from like stroke territory.
Huh.
So now I have to go see a heart doctor once every. So that's fun.
Yep.
But I mean, the nice part about it is thankfully it happened while I was in the military, so they get to pay for it for the rest of.
Have you discontinued?
Oh no, I'm still in right now.
Oh, okay, gotcha.
They actually just I just read a Breitbart article today. The circuit court in Ohio said that they're not allowed to kick me out for denying the vaccine.
Yeah.
We'll see how that all plays out. I'm not super worried about it. I'm actually kind of ready to get kicked out if I'm being honest. So I've
Yeah.
only got till March anyways on my contract. So
Gotcha. Well, this was all slightly. I've had this document for about a week or so now, but I had a conversation with my grandmother today who told me she was getting the booster, and I explained to her my position on the matter, and then I was like, let me go ahead and just share this document with the world. I need to fix my headset. I'll be just a second.
Sorry about that.
All right. Can you hear me now?
Yes, I can hear you.
Do I sound different to you?
No, I actually muted you for a second. My wife was asking me a question,
Gotcha. Well,
and
what
I've got
happened?
a head the earpiece in. So.
Gotcha. I
So you said your grandma. You said you were going to share the document with the world. You said your grandma was talking about getting the booster, and
my,
that's the last.
my last living grandparent is almost 90, and got the V and what it's like her doctor highly recommended getting the booster because of all the COVID going around Georgia, all the COVID, just so
Oh,
much COVID.
so
And
much of it that they have to shut everything down. Probably there's just tons of it.
so I've been frustrated with several topics recently, and this is definitely one of them. So in that 2 month period, here's their number. This is the
Is she
actual.
getting her smallpox vaccine too, so that she can be protected against monkeypox?
Yeah, I think I don't know what in the world the donkey socks thing is. Just
Well, unless you're, a middle-aged homosexual man who goes to flagrant orgies, your chances of getting it are basically zero. So,
so you're telling me that the entire presidential family is at risk?
yes,
Yeah,
that's basically exactly what I'm telling you. Hunter
yeah,
needs to watch out. That's what I mean.
that
That
guy, that guy
he,
for sure.
he might be he he, he might want to just lay low.
It's too late. It's too late. So I've been reading Jeremiah. Yeah, I've just been like, there's a lot of encouragement. I mean, the Bible is the best thing ever, and it's
Oh
really
yeah.
interesting to read, for instance, the book of Jeremiah and see um, that in some cases, and I'm not saying that we can necessarily know for a fact who, but in some cases we are told, or at least Jeremiah was told, I should say, not to pray for a group of people. Now, I'm not saying you sit here and you choose who not to pray for, but but it just so happens that there are those people or have been those people in this world that you're not even supposed to pray for because God won't listen to you. And did that only happen one time ever? And was it only in the context of God and Jeremiah having a conversation? Maybe, but it to me it stands to reason that it's possible that it could be
An ongoing.
a thing that could happen. Now, again, it's not something you can necessarily learn from. On the other hand, in my personal position on the matter, it's something that you can actually be comforted by, despite it being extremely sad and scary. Um, so it is extremely disturbing that there would be a person in such a position or a group of people in such a position that God wouldn't even listen to your prayers. That's extremely concerning. On the other
It is
hand,
disturbing. Yeah. Yeah.
for the sake of knowledge of justice and a reminder that God's got this and that there really will be true justice had, there will be those that are recipients of God's justice. I mean, right here, again, too
Well, and
much.
there's also those that God uses to judge. So
Sure.
I
Too,
could see that as a potential. He's just a tool in God's hand at this point, and he's basically just what we deserve. Not necessarily us who are following God's commands and doing the things that He says He's going to do, because we follow a different path, obviously, but the general populace of our nation, they're just getting exactly what they've asked for. So there's a precedent that God raises up too. So
42,086 adverse event reports in that 2-month period of time.
that's insanity. Absolute insanity.
It's an interesting doc. They don't want the general public to have it, but it's out. It's gone all over the place. I don't know who else has reviewed it. I haven't really looked on YouTube to see anybody else talking about it, but
Well, if there's one thing that you can be sure of, it's that the mainstream media isn't going to say anything.
yeah, and I don't know how long this has been available. All I know is that the dates on the emails are March of this year. March of
Yeah.
this year. So it's very likely that this was kept under wraps for as much as a year. And that's when they started talking about requiring the FDA requiring Pfizer to release their data and giving them, I
Yeah.
think, 75 years to do so. And then Congress or someone, some group of
It was a
people
judge.
said, never mind the 75. You need to do it in, was it
It
5
was like a
years
year.
or
No, it was
less?
less than that. It was
Okay.
like 10 months that they had.
Yeah, that's much more reasonable. I mean, so whoever said 75 years just was like,
Well,
I don't know what they were
their
doing.
argument was is that they just didn't have the manpower to go through and scrub it all and make sure that all the sensitive data and proprietary data wasn't released to the public and all this. It's like, yeah, we don't care about any of that anyways. Like nobody's interested in that. We're being completely honest. Like we just want to know how bad it's going to screw people up. That's really all we care about.
Look, I mean, in their statements, they'll say stuff like, will the vaccine give my child COVID-19? And then they say no with a period, and the vaccine does not contain. And yet, one of the adverse reactions of it,
Is COVID-19.
yeah.
Go figure.
So I had,
It's almost like they're giving you COVID-19.
yeah, I had some type of 111%. What does that mean? Events reported. I guess some of the people that got the COVID-19 vaccine also got other vaccines, um,
Oh,
and that's why there's other stuff there. But anyway, back in like February-ish, January maybe. I think it was January. I had some type of flu. I don't do that. When I was hospitalized last summer, I was
right.
forced to do the test twice. Short rapid test and the long test. But
Yeah, I have to take them every week, so that's fine.
is that something that you would hypothetically just as well be able to refuse if you chose to?
I could, but I mean, I don't really care. So it's just one of the little rapid self tests that I have to take every week. Just like a little tiny, like barely fits inside your nose. You swab it, and then it gives you some instantaneous result once you put it in some solution or whatever in like less than 20 minutes. I'm just required to take one once a week since I'm not jabbed. So
Yeah.
that's their stupid requirement. And honestly, if that's all I have to do, if that's the most inconvenience I have, I don't.
Well, they keep on saying that no one is fully vaccinated. This is the new worldwide truth. I know, I'm gonna discontinue my screen share there. The new truth is that no one is fully vaccinated. You're only up to date. There's no such thing as fully vaccinated. So up to date, like a computer or a cell phone.
That makes sense.
Yeah.
That's what they want us to be, anyways.
Yeah. So anyway, this is not this is not something that occupied a lot of my mind today. In other news, drinking water, redoing my back porch, and I went from I'm just going to redo the deck boards and the stairs to I'm going to redo the entire thing because it's in that bad of condition and I just didn't realize it.
We're doing some housework.
What's that?
So we're doing some housework also. We're getting ready to sell our house here in Nebraska. So
Okay.
and
Things not working out with it or what?
no, it's a great house. We love it and everything. I don't know. God told me it's time to get out, so I'm getting out. So
Okay.
I I can't honestly tell you why. Like it's just God said this is the time you need to sell it. So
Is this relocation stuff like to a new state or no?
quite possibly after I get out.
Gotcha.
Kind of leaving it open ended right now.
For
But
sure.
while people are still buying houses, I'm gonna go ahead and sell it for probably above market value because Omaha is still a really hot housing market. So
Good.
I'm going to sell it while I still can, and interest rates aren't 9 or 10% on mortgages. No, while
Yeah.
they're still relatively low and people are still buying houses, I'm going to sell this one, and then I'm going to take the money from this one and finish the Iowa house completely, and then sell it.
Yep. Well, you could buy 5 houses up here for what you bought that one for.
Yeah, yeah.
Things are
Well, and like our
pretty.
plan right now is to just buy a fifth wheel camper and live in that for a while.
Yep.
So
Hey, I have seen so many YouTube videos of people with 8 and 9 kids. I think even one with like 11 kids, um, in RVs, and fifth wheels offer the most room. So
oh, by far. So we picked one out that we like already. I'll have to upgrade to a slightly larger truck, but I'll do all that after for the house.
yeah,
And it's just so we can be mobile. We can go anywhere.
yeah,
And then I weirdly enough, God, I feel like God's calling me to go to Florida, which I have no idea why. It's just every time that I've prayed about it, every time I've thought about it, it's like that's where you're going. And it's like okay,
Florida
God's
man needs
moving
the
there for me.
gospel.
Yeah.
Florida
So
man
and
needs the gospel. That's why.
I found 20 acres down there for right under $70,000, which is incredible. And it's
Just over
raw
3.
land.
If it's
Yeah.
usable, you got to watch the marshiness and floodplain, like check it for floodplain and all that good stuff.
Well, it's got a portion of it that's floodplain A, but everything else is. And I figure that's because it's got a creek bottom
Okay.
there. But the rest of it's loamy sand, and there's house structures built all around it. So I would figure that if it floods that bad, people would put houses on
Yeah,
time.
And
There's
there's
oh,
ways to deal with that sort of stuff in Florida anyway. I mean, they build so many houses on stilts there.
yeah. So that part of it, I'm not especially worried about. Of the 20 acres, probably 6 of it is in the floodplain. So, and if at the worst, you could raise the floodplain, create some good irrigation through it, some big drain uh, culverts or whatever through that part of it, and farm on it. So, I mean, generally farm stuff right there. So, there's what, like you said, there's ways of it, and And my stepdad and my mom are looking to join us down there if we go. Actually, they're just looking to join us wherever we do the same thing. They're gonna sell the farm and buy a big truck.
Level Up said trailers are not ideal in Tornado Alley.
Correct.
That's certainly the case. Now, in regards to an RV and a fifth wheel, when Hurricane X is coming through, you just simply pack up and roll up the road.
Yep, that's the
Head
benefit.
north.
Yep, you go up to Alabama and Chilford. So,
Or Tennessee
but
or
the
North
air,
Carolina.
yeah, wherever, like somewhere out of the path of it. But
Yeah.
I mean that seems to be what we're working towards right now. So I just finished up brick retaining wall in the backyard and relocated our above ground pool. So that's all done, and we re-stained the deck and painted the house, carpets in. We're getting it all prettified up, and our realtor thinks that it's probably about or roughly somewhere between 70 and 90.
Oh, you're talking about the Iowa?
No, the Nebraska.
You're gonna sell it
We added a
for 70 to 90?
above what we paid for
Oh, I see. Yeah. Gotcha.
because the market has increased so much, and we've added a fourth bedroom in it, so we have quite a bit of equity in the market right now.
Yeah.
So that will be a boon. So obviously with realtor fees and everything, you won't end up with that much overall, but
Yep. So I have foundation and concrete experts, licensed people coming in the next couple of weeks. 2 weeks, about 2 weeks, 2 weeks away to check out, give me a plan. And there's
yeah,
something
we
called,
talked about that, and I remember you said that you were bringing some people.
yeah, there's something called a USDA Rural Development and Renovation Loan Program that I am going
Oh, nice.
to try to take advantage of. It exists for those who live in rural zones, which I definitely do, and have a certain income, which I qualify, and then it is a 20-year 1% loan, fixed
USD solid.
1%.
I don't think that quite qualifies as usury.
I don't think it does either. It's really about as good as it gets. It's pretty.
Honestly, if you could find a better rate than that, I mean, like my mortgage rate is at 2.75, so I mean, I thought that was stellar.
Yeah,
So,
it is.
but the next house I don't plan on mortgaging, so I plan on building it as I have funds.
Yep.
I plan on paying for my land with cash money and not incurring any debt.
40 minutes of nothing but adverse events. 1,291 of them. I mean,
That's
Magic Syndrome was on the list.
I don't even know what that is.
Aura, AURA, and Aura was on the list. Deja vu. That's not even a medical syndrome, but deja vu was on the list. And listen, just to anybody that watched the video, listen to this point. This is Pfizer's document. This isn't some person trying to drag up dirt and make stuff up. This is from the horse's mouth, as the saying goes, which is what I always do the best I can to share is from the horse's mouth data. It's from the horse's mouth, so I don't know what to say. The question at the title of the video, does it really matter? You know, my answer is yes and no. You know, on one hand, you gotta trust God. You know, on one hand, you gotta trust God. On the other, you gotta trust God. Both hands. Both hands, you gotta trust God. But here's the thing: Christians, people who love God, people who love the Creator, shouldn't play Russian roulette. This is a general rule. I think that that's a wise thing to say. I think. What do you think? Is that a wise thing to tell people? Don't play Russian roulette. You're muted. Maybe you're busy. That's my thoughts. You ought not play Russian roulette. I think it's unwise. Now, is that a metaphor for what was talked about? No, no, not necessarily. Um, you make up your own mind on what Pfizer said about their own product. I'm not here to tell anybody anything about that because you know I'm not you. You have to make up your own mind. And here's what I know. Here's what I know. The question of does it really matter? There are people who will listen to that whole list and they'll go, so there was a there was a person on Twitter. This is no surprise to most people. I get it. But there was somebody on Twitter who said, my, I think it was friend, was either double or triple vaxxed, and they got hospitalized with COVID-19 and died. But, if they hadn't have been vaccinated, it could have been much worse. That's a real tweet. Look it up. Look it up. It could have been much worse. Could have been much worse. So I think what happens is somebody listens to 40 minutes of 1,291 adverse events of special interest, and they go, wow, imagine, they in their brain, they go, imagine what it would be like, imagine how bad it would be if you didn't have the vaccine. Imagine how much worse it would be. Imagine how much worse it would be. You make up your own mind on whether or not that logic checks out. Because I'm not here to tell anybody what to do. I told my grandmother, I said, I told her what I thought. I'll not even say what I said exactly, but I didn't tell her what to do. I didn't say you need to. I didn't do any of that. I just said, here's my thoughts on it, and I was very emphatic, unrestricting. You know what the response was? It's just so hard to know what to do. It's just so hard to know what to do. And I ask, why is that? Because she's not the only one. Gosh, she's not the only one. It's hot in here. It's 83.4 degrees. Oh, whew, summer. I'm so glad it only lasts for 3 or 4 weeks.
Uh,
Oh.
3 or 4 weeks up there, huh?
As far as temperatures in the 85 and up, yeah, about 3 or 4 weeks. But those 3 or 4 weeks when you don't have air conditioning, you are thankful for winter. You actually, when you don't have AC up here, which I think a lot of people have AC up here, we're just special. You appreciate it.
That's
You're
really
like,
not
man,
that
I'm
big of
looking
an
I'm looking forward
inconvenience.
to those negative 20s.
Well, you can always put clothes on.
Yeah. We weren't, I kid you not, we weren't cold once all winter inside. Not inside, the house does its job. The house does its job. If we had a proper air conditioning system, like four or five, no, one, two, three, a bare minimum of three, but probably five mini splits. Whoa, I'm getting blurry. Five of them could do the whole house. It would be probably $5,000 or $6,000, and and is less important than getting a second bathroom. Really and truly, we'd rather have a second bathroom than air conditioning, because a room with a sink, a tub, and a toilet, and a shower in the basement. The sink, the sink, the tub, and the toilet are upstairs, on the main level. But then there's a separate shower stall in the basement. That is a very unusual and inconvenient setup. It just is. But hey, many millions of people, billions even, have lived and survived with conditions much lower standards, much lower standards for thousands of years. So I'm not actually stressed about it at all. And you know what? I guess I could share like a somewhat of a praise report sort of thing. I have slowly but surely gained encouragement and enthusiasm about how good God is, despite what old me and other people in the world would say or think about living conditions. I think we're not going hungry. We actually do have protection from the elements, a roof over our head, so to speak, and all these sorts of things. And when you actually consider, when you actually do consider your blessings, and you do focus on them, and you're actually grateful for them, in spite of, not despite, but in spite of any hardships, it's still way better. It's a good thing. And I don't know. That's where my mindset has been. I've been having increasing joy about God's gifts and how He provides, and I'm thankful for that. It's a better place to be than I know than the places I've been in the past. So anyway, if that encourages anybody else to do the same, then have at it with God's help.
Yeah.
It's been a little while, Mr. Bear Farmer. Um,
It has been.
been a
You've
little
been
while.
busy.
Yeah, I have to. I've been trying to stay consistent with my Thursdays. I've missed a couple, but I have been trying. I've been a lot more consistent than in the past. And Thursday nights, trying to keep it as a thing.
Well, I do appreciate it. It is very nice. We've been doing a study on James in church, and it's actually pretty cool.
Yeah, it's one of my favorite books. It's one of the ones I tried to memorize.
It flows very well. It's very good,
It sure does.
and it's just written to. I mean, it's written straight to the believer. I mean, I know most of Scripture is written to believers, but like that book is just like this is your practical everyday living guide.
All right. Fun fact on the book of James. His actual name was Yaakov, okay? But there's more.
For those of you that don't know, Yaakov is Jacob.
Yeah. Well, here's what's really going to blow your mind. As long as I don't mess it up, I'm trying to. Oh yeah. Here it is. The city, and I've talked about this before, but I don't know if you got to hear it the last time I shared this because it just was so profound. Not profound, just how neat. How neat. One of those kinds of things. The city San Diego in California and the city Santiago, Brazil. I'm pretty sure Brazil.
Santiago would be Chile.
Ah, gee. Yeah, I think you're right. Yeah, Santiago. Well, anyway, Santiago and San Diego are both in reference to Saint Yaakov, Saint Iago, Yaakov, right? The Latinization of the Hebrew, Jacob. So I thought that was so interesting, isn't it? You wouldn't know unless you dug in, and that's what etymology is all about. It's looking at the origin of words and stuff.
Well, and the only reason it was changed to James was because of King James. He wanted his name in
Is that the only reason?
it. It's one of them. I know it's for sure one of them. James
Well, here's the other
isn't a Hebrew name. So
Kohelet. The book of Ecclesiastes is originally titled the book Kohelet, the preacher.
hmm.
So that's another one of those book titles that has a drastically different name, except in this case, it's not a person's name, it's more of a title situation. But yeah, I thought the Santiago and San Diego thing was because I asked some people, Spanish speakers, I was like, do you think that Santiago is related to San Diego? And they're like, no, I think that those are probably different words and stuff. And lo and behold,
Hmm. Well, it's also, I think it's very interesting that etymologically, that the land of Iowa was originally pronounced Iawa,
yeah.
which sounds an awful lot like Yawa.
Yeah. I remember when you shared that. I mean, that really is it is peculiar.
And the fact that there was like Hebrew writing all over the Mississippian culture is in and of itself rather interesting. And Cherokee, the Indian language, shares a ton of linguistic properties of Hebrew. So,
I am really wondering. I don't know why I thought this exactly, but I started to wonder what were the sins of the North American Native Americans. Now, I think the South American Native Americans, it's easily identifiable. You've got idol worship and child sacrifice and those sorts of things that were definitely prolific activities. I'm wondering why it is that there's the North American Native Americans are almost um, they seem to just be revered in such um, a regal reputation, such a high and honorable reputation. Apart from the whole scalping and they're savages and stuff like that, animism, nature worship. Those obviously are some things that certainly could be derived from the North American Native Americans as far as some some of their sins. But what I mean is
They don't
this,
have the peculiar evil tendencies that the South American
yeah, that's kind of what
nations
I
have.
mean. And also you've got the whole Greco-Roman sins of, to put it, neat and succinct, would be like sodomy, for instance. You've got that being prolific. Now, is it that it may be that certain sins go hand in hand with economic, uh, maybe not economic, but
No,
let's,
I would say you're right on track there with economic prosperity, laziness, and
prosperity
it
would be
brings
one word.
more.
Easy life.
That's what I mean. Like economic prosperity brings leisure. Leisure brings like the more technologically advanced you get, the more can be done by less people, which frees up more people to get into the arts and gets into culture and thinking and philosophy. And then once you hit that gap where less people are having to frees up more time and people degenerate and you have too much time on your hands. And I mean it's been proven through hundreds of models that happens over and over, and that leads to just absolute degeneracy and people question the gods. When you're busy working, you don't have time to question it
Yeah. Yeah. Well, that's
because
exactly what
your
I was.
survival depends on
Yeah. And I think that continues to be a life principle. The harder things are, the more there's so much value or quality that comes out of somebody that goes through hard times, and yet everybody just wishes that they had an easier life and stuff. It's just kind of I'm distracted because I'm reading what gotquestions.org gives a very interesting description for why Jacob became James. They said it was the Greek to the Latin that then got influenced by the French and then the English, and that four-part or three-stage influence process is how we got James instead of Jacob.
I mean, that makes a lot of sense given the fact that it was the Greek Iesus, which was translated to Latin, for the Vulgate for Jesus, and then, because like etymologically, if you follow English, it would be Joshua. Like that's the name of Jesus. Like it would
Hmm.
English would be Joshua. It wouldn't be Jesus. But because you had the Greek to the Latin to the English, you had
Exactly.
this transliteration. So it's you know what I mean. It's the same thing with James.
It is
Instead of going
apparently
the
the same
straight,
thing. So what they're saying
yeah,
is that when it went to the Latin, it went from Jacobus to Jacomus. The B changed to an M in the Latin, and then the French did uh, Gemes instead of Jacomus. They did Gemes or James, and then James became
Yams, yeah,
James. So
yeah.
it is really interesting when you just remember all that happened between about 1500. Well, really, I guess you could go all the way back to 1000. From, yeah. Anyway,
Yeah,
Iha.
it's transliteration and which route you get where,
Yeah.
which languages you translate it from. Like if you go straight from Hebrew to English, it's Jacob. Like
Yeah.
there's no way around it. It's Jacob. If you go
So
straight from Hebrew to English in Yeshua, it's Joshua. Like, but if you go the route from, through the different languages, and you end up with a bunch of different things. So
so are your
it
kids
depends
taller
on
than you yet?
almost. Gabe's got about another inch and a half before he gets.
Goodness,
He turned 15 this year. What's that?
it do be like that.
Don't
Alrighty.
love it.
Well, I am going to go ahead and end the stream. I've got some words to share with you off stream. If you could hold on for just a minute and say goodbye and good
Sure
night
thing.
to the stream, and I'll see you next week.